Good morning, everybody. I'm here with the beautiful Brenda Brown. You look nice and festive, Brenda.
Thank you.
And so, Brenda, you got your stem cells 9 months ago in your knees.
Yes.
So we just did the reevaluation. So tell me where you were 9 months ago. First, on the pain scale, on a scale of 1 to 10, how bad was your pain in both your knees, Brenda?
The pain in my left knee was unbearable most of the time. I was ready to have surgery. The doctor told me I needed surgery, and I came here instead of surgery. Now, in my other knee, I have kind of a little bit more of a different problem with my IT band, but that has also helped in that knee. So I would say the difference in my pain is about 90%.
Wow, so
All
9
the
months
time.
later.
Yes.
And we just looked at your x-rays. The x-rays look good. And
Yes.
didn't you tell me that at Mercy Hospital, you went to see an orthopedic
Dr.
doctor,
Abbott.
and he said you needed surgery?
Yes, on my left knee, that
Okay.
I could have surgery anytime.
Right.
And I had had several shots. I tried all of the shots that you can have in your left knee, and I couldn't have any more shots. And then I realized, as I was told by a professional nurse, that the shots were damaging my knee. And so I was even more wanting to have the stem cells because of that. But I do believe that any new cells are much better than any type of surgery. Surgery was my last option, and I am so thankful that even with what I have, it's not 100%, but I believe that it's getting better every day. And at one point, I will be able to say that I'm 100%.
Excellent. Well, thank you, Brenda. And real quick, on a scale of 1 to 10, how bad is your overall pain right now on a scale of 1 to 10?
0.
0.
Yes.
So even 9 months later,
Yes.
and you just told me a couple minutes ago, you're still continuing to improve.
Yes.
Which is great.
Yes.
The range of motion's better. Excellent.
Yes.
Okay, Brenda, the healing will continue to improve, and
Yes.
we'll see you next time.
Okay.
Thank
Thank
you.
you.